SAGE Eldercare's mission is to promote the independence, well-being, and quality of life of older adults, their families, and caregivers through the provision of client-centered health, social, and support services. Yeah, our philosophy is, let our family take care of you. We hope that we treat everyone like we would our own family. Spend a Day is SAGE Eldercare's Adult Day Health Center. Well, Spend a Day is great for older adults who are in the community who would like to remain living at home but are isolated or need care during the day or seek companionship. The staff is comprised of registered nurses and licensed social worker, a certified recreational therapist who plans the activities, and a full array of program staff. So we can really accommodate everyone's daily needs when they come to the program in a fun, active environment.
Yeah, she needed the socialization and she needed the activity, and she wasn't getting it at home. So one of my friends suggested SAGE, and I really never thought about a daycare situation. This is her life, and I have to waken her. I don't tell her to get up. I just call into the room. It's a SAGE day. Do you want to go to SAGE today? And she's out of bed like a shot.
In the beginning, she was anxious to come because it was a change from being at home. But now on Tuesdays and Thursdays when she comes, I call this senior club. And I say, it's time to go to senior club. And she gets up and says, good, let's go. At the end of the day, and asked how it was, she'll say, everyone is so nice to me, young and old. So that is something that she keeps with her all the time.
Well, it's given a tremendous amount of relief to my mother-in-law, who is his primary caregiver.
I understand.
And she is much healthier now because she has the relief of taking care of him daily. Yes, we've been very fortunate that my in-laws have qualified for financial aid for him to attend the program for 5 days. He started out coming 2 days a week, and then it increased to 3, and we convinced my mother-in-law that 5 days was the best for him, and thanks to the aid, it's worked out very nicely.
The Spend a Day clients who come to the program have various needs and interests, and so what we do is plan our calendar accordingly. We provide programming simultaneously to accommodate people's various interests and needs, and also levels of functioning. We can accommodate people with few impairments and accommodate people with middle to late stage Alzheimer's.
So we're all glad to be here because we have someone to talk to.
Our Meals on Wheels program started in 1966. We serve parts of Union, Morris, and Essex counties 6 days a week. We have a large group of volunteers that delivers Meals on Wheels, about 125 a week. We fill 14 routes. We have about 400 volunteers total at SAGE, actually more than that if you consider a lot of the community groups that come in and help. And they help anywhere from Meals on Wheels to our shopping service, to helping at Spend a Day, they help in the office. We're really blessed with the types of volunteers we have. We have professionals, we have moms with kids, we have active retired people, and it's just wonderful to be here every day and see the caring people that walk through our doors, and all they want to do is help.
I get out of meeting the people that I work with and come in contact with when I arrive, and it's a good fellowship, and then I go out to give food to some people that may not see anybody that day, because a lot of people live alone, and they may talk on the phone or they may look at television, but that's not the same as a person. And it's my way of giving back something that was given to me.
Well, the people at SAGE were so nice to come and help my grandmother out when she needed it. And then I saw the opportunity to help everybody else. So I thought maybe I should come out and volunteer.
So each client has a volunteer, and I try to match the same volunteer to the client, because then they develop a social relationship. Sometimes our volunteer is the only person they're going to see that day. And if there's a problem, the volunteer will call SAGE, and we will get in touch with a family member and try to resolve the problem. And our clients are thrilled with it because they're getting their groceries. They can stay in their home. They don't have to be in assisted living, and the family is relieved of a chore.
When we started home health care, and the home aides came in and, you know, took care of Pop. I noticed he became more motivated to try things, to get back out.
She felt lost and just didn't know anybody, but after coming here, she's made some nice friends because she needed something to look forward to, and this was the answer, our answer.
Since 1959, SAGE's resale shop, now located at 31B Chatham Road in Summit, has helped provide funds for SAGE Eldercare's programs and services. The shop's unusual variety and exceptional quality of goods have attracted collectors and homemakers alike from Summit and many surrounding towns. Since 1961, SAGE Eldercare's Furniture Restoration Workshop has provided the public with fine quality furniture repairing. Dedicated volunteers will work on any piece of furniture that can be carried into the workshop. The workshop has earned a fine reputation for repairing and reweaving cane chairs. All proceeds from the Furniture Restoration Workshop support SAGE's programs and services. People can also call InfoCare, which is staffed by a social worker, and our social worker can answer any question people have about senior resources in any area.
We're very dependent on support from the community to be able to sustain the programs we have here at SAGE. So we do get funding from large foundations as well as family foundations and some local corporations.
Feel this way and know each day you're part of me, the best part of me in every way. If I could find just the place, then I'd live there with you. If I could paint just a face, it's your sweet face that I